last time I talked about why we take photos and what we use photos for. So today I thought I would talk about why we take x-rays and what x-rays are used for. So right here next to me, I've got what we call our panoramic machine. It is digital, which means it has lower radiation exposure, which is awesome. And then as soon as we take the image, it pops up on our screen so we get immediate feedback. The panoramic looks like a skeleton picture. It spins around your head and then we get to see everything in one view. It allows us to look at the TMJ, the sinuses, and it looks at all the roots of the teeth and the teeth themselves. So we're checking for any abnormal bone pathology, cyst, we could see tumors on that, any abscesses with teeth, just anything out of the ordinary. We're also just checking to make sure things are healthy. So we want to make sure you do have good, healthy bone levels and healthy teeth. So that's the panoramic. If we don't have one, we'll take one on you, and then we repeat it every 3, 5, 7, 10 years. It all just depends on each patient and what their need is. The other type of x-rays we take are bite wing x-rays. These are the ones that are on the sides of your teeth when you bite down, normally taken during your cleaning appointments. These allow us to have eyes where we can't have eyes. So they allow us to see in between your teeth for any cavities and also check those bone levels as well. The other style we might take is called a PA or a periapical. And it's an x-ray that we'll take if you're having any pain or discomfort with the tooth or swelling. It allows us to look at close-up of that root to see if there's any infection or abscess. Those type of x-rays are usually as an on-need basis. Those bite wing x-rays I talked about, we take about every 6 months to 24 months. Again, it just depends on each patient, their caries risk, the treatment they've had, and what their needs are. So these are why we take x-rays. And if you have any questions about them, you let us know. And thanks for tuning in.